the situation at your organization?
Yeah, COVID as a disaster is very difficult to define what kind of distress it has brought in. We were doing in a day around 1.25 crore turnover, which suddenly became 1.25 lakh turnover overnight.
Oh.
That means in a lockdown, in a diagnostics business, which is largely logistics dependent, has completely collapsed. That is the disaster of the disease. But then we started testing for COVID. But then in COVID testing, every day everyone is learning, including the health ministry from central government to the state government to the local municipality. All of them keep changing advisories, and some advisories don't match with each other, and we have to match with all the three advisories. And it has been a very big hell, because every now and then there is a SOCAS notice citing a Epidemics Diseases Act, which we were not used to. We are only testing people. We know testing, and testing is easier. But if we are asked, why did you collect specimen from that patient, it is very difficult for us to know which patient to be collected and which should not be collected. And giving the result back to the customer after, a route through the municipal corporation also has taken its own toll. Having said that, we all have increased the capacities to do testing. What we started with 400 a day capacity today is around 3,000 a day capacity. So we have scaled up. Our expertise is there. Getting the man to work in lockdown is a very big challenge. Making a man to work in a healthcare facility is much bigger challenge. Making him to stare at the live virus in the laboratory is a Himalayan task. So motivating them and making them to work is another big challenge. We have done around 35,000 swab testing in this last 60 days. I must sum it up. The experience which I have had in the last 60 years of life and what last 60 days of my life, both are equal. The learnings as well as the way in which we have adapted to the new COVID, non-COVID fears, lockdown fears, and sticking to the advisories of different governments. So overall, it looks like we have managed to master the testing, but the rest is left to the government to see how much more to test it, whom to test, how long to test. All these things is government's policies, and we are very eagerly awaiting. Let me sum it up. The control of industry, be it diagnostics or hospital, it is not in the hands of the CEO of the organizations. It is in the hands of the administration.
Very well said, sir. I think you made a mention of 60 days learning equivalent to past 60 years. I believe this 60 days learning will at least help us survive for next 60 years. You made a very pertinent point, Dr. Velumani, about the regulation and about the policy, framework, and particularly in terms of diagnostics. Pathology is a very localized, stream with very low entry barriers. More than 50% of the industry consists of unorganized or at best semi-organized. And I think a very paltry 1% of path labs are accredited. So a large portion of fatalities occur due to untimely and improper diagnosis, especially in rural and semi-urban areas. And this I'm talking in overall context, even without COVID, for example. So what measures in your view can be adopted as directional steps to address this menace? So we have a country with proper and timely diagnosis leading to reduced fatalities and a healthy life going.
Yeah, the country is very vast. The geography is too difficult to tame and work. And also another reason is it is not a government of India purview. It is the state government purview, which says each state will define its regulatory methods and controls. Having said that, anybody can do the test is wrong. Anywhere test can be done is wrong. and not following any quality is wrong. So it is going to be a tough time for the state to bring in an order and register all of them, give guidelines to all of them, prescribe what quality control they need to follow if they have to report. I think, as you said, it's hardly a percent or two if the laboratories are accredited. I think without the 51% accredited laboratories in a country, you just can't control anything. So having said that, we have moved very slow in the last 20 years in number of hospitals or laboratories accredited for laboratory testing. I have a reason to believe this tappad of COVID. I call this tappad because it has come as a very powerful slap on everybody's cheek. It's not only administration, not only healthcare, it is entire society. Is likely to facilitate this mechanism of monitoring quality across the country and make it accessible at the remote districts of the states of the country. It's a journey, and I believe this particular episode, which happens in 2020, will, as you said, will form a basis for next 60 years. And things should move, and if things don't move, we are idiots. We have not learned.